Are turning now to medical rounds. This fall, something big is happening on the campus of Hartford Hospital. Hartford Healthcare's Bone and Joint Institute at Hartford Hospital will open its doors. The institute will consist of a 5-story inpatient hospital connected to an ambulatory surgery center. And this means that all the care you need for orthopedics will be in one place. Joining us live is Dr. Cortland Lewis, Physician-in-Chief of the Bone and Joint Institute, to tell us more. Good evening, Dr. Lewis. Nice to have you here.
Good evening.
Well, tell us more about this new Bone and Joint Institute in the Ambulatory Surgery Center. What will it consist of?
Well, you're right. It's an exciting time on the Hartford Hospital campus as we are 6 months away from opening the first standalone orthopedic specialty hospital, not just in New England, but actually in the entire Northeast over the past 50 years. So it will be a full-fledged hospital where if you need to have a bone and joint problem taken care of, you can do that. On the inpatient side, there will be surgery taking place in 8 new operating rooms with private patient rooms. For me, an exciting part of this is a specialized area for physical therapy, some wellness training, and believe it or not, a demonstration kitchen to teach people healthy eating. Across the street in the ambulatory building are there some medical offices as well as an ambulatory surgery center, and it's designed so that if an outpatient operation requires inpatient care, that we have the ability to do that without causing any injury to anybody, and in fact making it as safe as it can possibly be.
It sounds wonderful, and as you've been speaking, Doctor, we were looking at the animated version of what the hospital, the institute, will look like, and it is amazing. I have to ask you, though, about the future. Let's push ahead 15 years from now. I understand that the demand for hip and knee replacements will be off the charts, so to speak. Why is that happening? We're just aging as a population?
Well, we are, and the baby boomers, of which I am one, so I'm a little sensitive about this, but the baby boomers are getting to the point where they need more and more orthopedic care, and so we need to be ready for that. Beyond that, the issue of obesity in our society is a huge one, and we know now that obesity is directly related to the earlier onset of arthritis of weight-bearing joints like hips and knees and ankles, and so this is a big health issue for us across the board. This is an opportunity for us not just to do surgery, but to develop programs to help people by intervening earlier before they even need to come to surgery, so that we hopefully can prevent some of these problems earlier in the course of diseases.
That's always a good idea, and we thank you so much, Dr. Cortland Lewis, Physician-in-Chief at the Hartford Healthcare Bone and Joint Institute at Hartford Hospital. Good luck. It looks like a great facility. For more information about the services provided, you can call the number you see on the screen.